Okay, now we just cleared the COX pathway, LOX pathway, the production of the prostaglandins, thromboxans and leukotrienes, their actions. Now it is time to move toward the next point, the mechanism of action of the aspirin. When you take aspirin, this actually fires this COX enzyme and it inhibits this COX. When the COX is inhibited, what is going to happen? One very important point regarding aspirin point, if you remember, it is non-selective COX inhibitor. Means it inhibits both the COX-1 and COX-2. When these are inhibited, what will happen then? Your pain, your fever, your inflammation, gone. You know why you people are taking the aspirin? What is the need to take aspirin? Whenever we feel pain, fever, inflammation, etc. somehow, so we take the aspirin, we go for the aspirin and we take it randomly. Do not take these all stuff random. Now what is the reason that I'm telling you people not to take it randomly? Because it is going to cause the complications. What kind of complications we'll know later. First of all, let's come to the point that when you take this aspirin, it blocks the COX enzyme. When it is blocked, so your COX-2, COX-1 both are blocked, and that will result in alleviation of the pain, alleviation of the fever and inflammation. And sometimes when you're taking this aspirin without consulting your doctor, it is going to cause complication. Do not take it randomly. Sometimes it can cause the ulcer and asthma. And there are some other complications, but these two are the very major complications regarding the aspirin and regarding our today's topic also. So how the aspirin is going to induce the ulcer? Let us clear this point. When you take the aspirin, it will inhibit the COX enzymes, and when the COX are inhibited, you know COX-1 is responsible to interact with the arachidonic acid. After it interacts, it is going to produce the prostaglandins, thromboxane A2. Regarding mucus point of view, prostaglandins are responsible to produce the mucus, which is going to protect our gastric lining. Means our stomach is then protected from the acidic attack. If we are inhibiting the COX by means of the aspirin, this will actually decrease the production of the prostaglandins, because when you inhibit the COX, then the COX-1 is not going to interact with arachidonic acid, and if it is not interacting, the prostaglandins are not produced, and if they are not produced, then the mucus is not produced. So if the mucus is not available, then the acid is free to attack the gastric lining. Like this, the gastric lining will be eroded, and we call this as ulcer. This is how the aspirin is actually causing the ulcer. Aspirin blocks the COX, by means of which the COX-1 is not interacting with arachidonic acid, and due to which the prostaglandins are not produced. And if the prostaglandins are not produced, the mucus is not produced. And if the mucus is not available, your gastric lining is no more protected. Means you are prone to ulcer. Now let's know about the aspirin-induced asthma.